Hi, my name is Kevin,
And my name is Angelica.
and we're here to present the utilization of point-of-care cardiac ultrasounds in detecting ischemic cardiac abnormalities on ST-elevated myocardial infarction patients in the emergency department.
So the goal of our study is to see if we're able to detect and see how effective point-of-care ultrasound is when detecting culprit occlusions within STEMI patients. Our question is the use of cardiac point-of-care ultrasound effective in pinpointing culprit occlusions? We predict that cardiac point-of-care ultrasounds can effectively identify and pinpoint culprit occlusions, as well as other regional abnormalities in the walls of the heart for STEMI patients.
And as for some background, a plethora of patients come into the emergency department complaining of chest pain every year, and as a result, myocardial infarctions or heart attacks are some of the leading causes of death in America. With that being said, the time spent diagnosing a patient that presents in the ED with chest pain, specifically an ST-elevated myocardial infarction or STEMI, which is considered the most severe type of heart attack that involves a full occlusion of the coronary artery, is a highly critical process. The faster an occlusion can be detected, the quicker an angioplasty or percutaneous coronary intervention can be performed to extract that cardiac occlusion.
Electrocardiography and natural biomarkers are the current gold standard of diagnosing STEMI. However, in some instances, ECGs and biomarkers can be non-diagnostic and can fail to detect a STEMI at early stages of the infarction, even though there is chest pain present. Non-diagnostics concerning STEMI can be very concerning, especially during this era of 2022 to 2023, post the COVID-19 pandemic, as it has affected potential STEMI patients. Due to the COVID-19 pandemic, there's been a significant delay in hospital presentation of patients suffering myocardial infarctions, as patients have a fear of contracting the virus in the hospital. Understanding the time-sensitive nature of STEMI diagnosis and treatment can help perform and determine a reliable diagnosis method and which is pertinent in diagnosing delayed patients.
As a result, the goal of this current study is to see if there is another method for diagnosing a STEMI to treat patients as soon as possible. Bedside cardiac ultrasounds are effective to detect regional wall abnormalities, which is a cardiac abnormality caused by an occlusion in any of the coronary arteries. Thus, the study aims to establish cardiac ultrasounds as a diagnostic tool for STEMIs that can detect cardiac occlusions to help promptly activate angioplasties and coronary interventions.
All right, and then now just to talk a little bit about our approach and methodology of the study. Currently, the ongoing study takes place in the ED of the UCI Medical Center, in which we'll screen for patients who have the STEMI activation code. We'll then confirm this patient has a cath lab activation and then obtain HIPAA and consent forms from the patient and or a witness that's with them during the time of the STEMI. The physician will then perform a peristernal short axis ultrasound view of the heart to check for any regional wall abnormalities. And every 2 enrollments, the ultrasonographer will get a $10 gift card for being able to help out with the study. The physician will then fill out a worksheet indicating where the occlusion is, and they'll predict based off the EKG and the ultrasound findings. The forms that the ultrasonographer then fills out determining where the abnormality took place will then be compared to the catheterization report to determine if the ultrasound was able to effectively detect the STEMI.
And these are just some of our inclusion and exclusion criteria. Some of the most important ones being that they're over 18, they have STEMI activation, they're also activated for cath lab, they haven't come in for any psych reasons, or they're not incarcerated, and that they don't have any previous cardiac abnormalities. On the right, you can see what a STEMI or coronary occlusion looks like anatomically in the heart. And you can also see what a STEMI looks like on the EKG with the S and T waves elevated. And on the left is the peristernal short axis view, which is what the physicians view the ultrasounds when we enroll our patients.
Just some preliminary results and outcomes from the study thus far is that we have seen that there's been an established relationship between regional wall abnormalities in certain parts of the heart, along with presented in STEMI patients. Cardiac point of care ultrasound is effective in predicting the coronary artery containing the culprit occlusion.
However, we have determined that cardiac ultrasounds are not effective enough to be the sole method of diagnosing patients. We see the future of medicine in diagnosing STEMI patients as both with ultrasounds and cath lab activations, just to speed up the process, which a patient can get to a cath lab as soon as possible.
All right, and thank you so much for listening to our presentation. The following are references. Thank you.
Thank you.